Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Melissa Batchelor. Good morning.
Good morning. How are you?
And I felt maybe I was a little disrespectful. I should have said Dr. Batchelor, and so because that's you've accomplished a lot, and I think you should be recognized by that. And so my apologies on that one. But we're going to talk about today a subject that I have enormous amounts of clients come through my office trying to figure out how to choose a quality nursing home. And so this couldn't be a better podcast, for us today. And I appreciate so much you being on and giving us a chance to go through this today.
Well, thank you. And just to clarify, it is Dr. Melissa Batchelor, but I am a nurse and a nurse practitioner with a PhD, and I have over 25 years of experience caring for older adults and their families. So very excited to be joining you.
Yes, good. Perfect. So let's kind of get started. And so, because a lot of people, when they're thinking about how I've got to place somebody in a nursing home, what are the key factors? What should they be considering when they're thinking about choosing a nursing home?
So I think the first thing that you need to know is what type of care does the person need, and balance that kind of with what they want. Because not all people that go to a nursing home are there as a long stay resident. A lot of people go as short stays, meaning you may only need to go there for rehabilitation. So say you were playing golf yesterday, living your life independently, but you're over 65, you fall, you break your hip, you end up in the hospital, and you can't go back home immediately independently. A nursing home is a good rehabilitation option. So nursing homes tend to still have a lot of stigma, and no one wants to go to a nursing home, but sometimes you need to go because that's where you need to go to get strong enough so that you can get back home. So knowing what type of care your loved one needs is going to be first, and there will be caseworkers in the hospital that can help you make that decision, tell you what nursing homes have availability. But if you are a person whose loved one is at home still, that's when you would work with your providers, because to make sure that that's the correct place. There are a lot of other options that are available to people before you get to a nursing home, unless there's been an acute event like the hip fracture I was talking about. So I think that's the biggest thing. And then understanding what type of care is delivered in skilled nursing homes compared to other settings is really kind of where you start. So talking to your healthcare team, and finding out those things are most important when you're getting started.
So let's talk a little bit more about that. What type of care is provided in the nursing home?
So typically nursing homes are more focused on the medical care that a person needs. So it's a medical model of care compared to like an independent or assisted living facilities are based more on a social model of care, meaning people in assisted living and independent living are more independent. They don't have these medical needs. And the medical needs pretty much mean that the person needs 24-hour, like 24/7 supervision of some sort that needs to be delivered by licensed nurses. And when I say licensed nurses, I'm talking about a registered nurse. It's a team of nurses, but it's led by a registered nurse or an RN. And then the other members of the team are licensed practical nurses, licensed vocational nurses, so LPNs, LVNs, and certified nursing assistants or CNAs that deliver the bulk of like the daily care that's there. But nursing homes provide, 3 meals a day, even including assistance with eating, but they can also help you with things like getting dressed, getting a shower or bathing, even to helping you eat your meals if you need that type of assistance. But they also offer these rehabilitation services. So if you need physical therapy, occupational therapy, speech therapy, all of those things that could help a short stay resident get back home independently, that type of care is only offered in a skilled nursing facility. Now, that's not to say that if you were in assisted living, you couldn't have somebody come in to do those things, but it's not covered as part of your stay. So you basically need some skilled care, and by skilled that means care that's delivered by a licensed nurse in some capacity.
So a lot of clients are, in my office in particular, trying to figure out how they pay for it. How you pay for care. And so what's been your experience?
So with nursing homes, you have to have a qualifying stay if Medicare is going to cover some of those costs. Assisted living, independent living, those are all out of pocket, but Medicare in and of itself does not cover more than the first 100 days of your stay. So the first 20 days, 100% of the care that you receive is covered by Medicare, but then days 21 through 100, there's like a copayment that goes with that. So if you have secondary insurance, it would be a blend of Medicare first, then your private insurance. And if you end up staying past the 100 days, that's when you're going to have to spend down your assets. So you then become a private pay resident, and you have to spend down your assets until you have a certain amount of money left in the bank, sometimes around $2,000, in order to qualify for Medicaid. And then Medicaid will pay for your long stay for the rest of your time there. In order to evoke your Medicare benefit for skilled nursing, you have to have a 3-day qualifying hospital stay. So this means you can't be observation only. You have to have been admitted to the hospital for 3 days, and then that will trigger your skilled nursing coverage through Medicare. So that's really kind of how that process works. And if you are under 65, it's going to be different. But for people over 65 on Medicare, that's typically how it works.
So Melissa, I just wanted to let our listeners know, because here in Texas, it's a lot easier to qualify for Medicaid without having to spend completely down. And so there's a lot of times where, especially married couples, one can qualify and the other one can continue to keep all of their assets. So I don't want our listeners to think you have to go broke in the nursing home. And so, because here in Texas, we have a lot of flexibility when it comes to, to paying for it. And so, Melissa, how important is it to visit potential nursing homes ahead of time?
So it's really important, just because when you end up in the hospital for 3 days, that's already a very stressful time. And sometimes you don't have advance notice, like there's something happens, it wasn't expected, somebody falls, they get hurt. But if you know that your loved one is kind of becoming more frail and is going to eventually need nursing home care, it's a good idea to go ahead and visit, talk to family and friends, find out what their experiences have been with some of the facilities in your local area. This is also a good time to talk to the finance office to find out how nursing home care is going to be paid for in your state, because there's variation state to state. But you basically you can get a nursing home. You can go to Nursing Home Compare, Medicare's Nursing Home Compare. It's a .gov website. And you can enter your address and zip code, or the address and zip code of your loved one, and it will give you a list by distance of where those facilities are, because for a lot of families, it's important that the facilities are close. And then, I've even developed a nursing home checklist that kind of guides you through all the different information you can get from the Nursing Home Compare website. There's a 5-star rating system that the government gives all of the nursing homes in this country. So you can actually do a lot of that work online and then set up appointments to go by to visit. Because if you have an idea when the caseworker, or your provider says, well, here are 3 different facilities that we would recommend or that we go to, then you can take your checklist, to those facilities, and you can go to the building, meet the staff, at least the staff that work there right now. Nursing homes are notorious for turnover, but you at least have seen the building and gotten a general sense of what your impression is of that facility ahead of time in a non-crisis situation. So I always recommend that, it might take, a day or two of your time, but at least you have some idea of how they stack up, because they all look a little bit different on the inside. Maybe one has they offer buffet style dining. Another one is the more traditional, like they deliver the meals in the meal carts. So there's a lot of different things that you can get by using a checklist, making notes, so that you kind of have that ready to go for when you have to make this decision.
Yeah, we tell clients a lot that you should probably maybe 3 times. Once, like you suggested, you talk to the business office, things like that. Maybe once in the evening, and talk to family members that are there visiting their relatives. How's the care here? And then if it's close to the weekend, find somebody on the weekend as well, because people visit different times. So you might find family members that are only there on the weekends versus there in the evenings. And so, because I think it helps a lot, so, but you mentioned something.
And talk to the residents too. The residents can talk, they're the ones that are 24/7, finding out if they have a resident council, how much autonomy do they have over what time they go to breakfast, when they can get a shower, what are the visiting policies like? So a lot of those things you can, find in a checklist. And then that way it does give you a good place to start, because it really will ultimately come down to kind of bed availability. But if you have your top 3 or 4 choices, one of them is probably going to have a bed that will be available when you need it.
So one of the things I heard you say was there were questions, and that you had a list of questions on your website. So what kind of questions should families ask?
Well, so first of all, you're looking to see kind of what their health ratings are, and that's the information you can get off of the Medicare.gov Nursing Home Compare website. You want to know too, that same website will tell you if they've had any inspection reports that show quality care problems. And if those facilities have had problems, when you go, you can ask, have these things been corrected? What was your plan? So kind of asking about their quality improvement process. You're looking at their safety and care, like how does the facility handle an emergency or a disaster, like hurricane, especially in southeastern United States. What hospital would your loved one go to if they needed to go to the hospital? Who's their medical director? How do they get to see a dentist? Do they provide mental health care? The next kind of category is preventing and reporting of abuse. If a resident has a safety concern, or a family member has a safety concern, kind of what is the process for reporting that? And on the Medicare.gov website, if a nursing home has been cited for issues related to abuse in the last year or two, there'll be a red circle with a stop, like a little hand in it, so you can actually see that. The next category is the nursing home appearance and livability. Do the residents look well-groomed and dressed, for the season? Does it smell good? Does it appear to be clean and well-kept? Is there an area where family and friends can come and visit for a special occasion? Will this be a private room or a semi-private room? Do they have a way for the person to lock up their personal belongings? The next category is kind of menus and food. Can you bring in food from the outside? If you do, where does it get stored? Are there choices about foods at meals? What type of dining setup do they have? So I mentioned buffet style dining. That's when, the staff can go to a buffet and pick the food items that the resident wants, compared to just being given a tray of food, and those are your choices. The next category is staffing. The staff themselves and staffing. Is there a social worker on call or in the building? Is there a registered nurse that's in that building 24/7? And if not, how often is a registered nurse on site? How many staff do they have working on each of the shifts? Do they do the typical 73, 3 to 11, 11 to 7 shifts? And then do the same staff take care of your loved one every day, or are they constantly switching assignments? And then the last 2 categories are activities. Historically, nursing homes, we're kind of locked into the Bible and bingo. So we want to know, like, do they have other activities? Do they take field trips if the resident is physically able, to do that? Is there a place where they can go outside if they want to? Do they get to choose when they get up, when they go to sleep, or when they take a bath? What are their visiting hours? And then if the person needs dementia care, looking to see how many residents that have a diagnosis of dementia are prescribed antipsychotics. That's another marker that you can find in the Nursing Home Compare website. And then what is the staff training for dementia care? And, do they offer activities, at night in case your loved one happens to be like, get their days and nights flipped up. And then the last part of the checklist is just talking to current residents and family and friends in that way.
Perfect. That's a lot of information. And so, that's great information. It's a lot of it. So what other resources are available to help families make this decision?
So if the Medicare.gov website or the Nursing Home Compare website is the best place to start when you're looking at quality. You can also go to a website, just Google Elder Care Locator, but you can also call them at 1-800-677-1116. They can help you find care in your area. You can go to another website called longtermcare.gov, and that will give you information about housing options and other local services that are available. And then you can also call your local area agency on aging or your Department of Human Services from your state or government. And sometimes you can Google area agency on aging, probably with your zip code. That will come up, but it'll also come up in that Elder Care Locator website. But these are sometimes just called senior centers. So I'm not sure that a lot of people kind of equate the area agency on aging to a senior center, but that's what they are. And most counties have one.
And so, this has been great. And so, Melissa, if anybody wants any more information from you, how do they find you?
So they can find me at my website, melissabphd.com. I also have a weekly podcast. It's called This Is Getting Old, Moving Towards an Age-Friendly World. And on that podcast, I've been doing it about 4.5 years now. I talk about aging, age-friendly initiatives, and Alzheimer's disease. And but on the website, that will give you all of my social media links. The podcast is on YouTube. It's also on several audio-only platforms. And I've taken all of my podcast content and actually developed a new membership library called AgeWise U. And you can join either as an insider or as an MVP. If you join as an MVP, all of that content has been curated for you. So when you click on the Alzheimer's link, it's divided by early, middle, late stage Alzheimer's, as well as brain health for prevention, and then caregiver tips and strategies. And I continue to add to that each week, but you can basically just go to melissabphd.com and you can find all of those different things, all that information.
Perfect. Melissa, this has been great information, and I appreciate so much you being on the show today. We look forward to having you on again soon.
All right. Thank you so much.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.